tout le monde. Nous allons donc démarrer la séance ce matin.
I'll start this morning session that I will facilitate with Miss Ouided BOUCHAMAOUI. My name is Professor Fatou Sosa. I'm the Director of the Gender Laboratory and Scientific Research IFAN at Cheikh Anta Diop University. After this very short introduction, I will give the floor to Mrs. Ouided BOUCHAMAOUI. First of all, I would like to remind you that today we are gathered here to look at Women Leaders Forum, Women in Science, Technology, Engineering, Mathematics, facing COVID-19. Facing this pandemic, women were the biggest victim because they've been heavily hit by the pandemic. And despite all of this, there were some studies that were carried out. And today we know that they have been resilient, the population and also the public authorities as well, whether researchers, civil society, NGOs, they've all all set up activities, and this session will help us to look at that. Miss Ouided BOUCHAMAOUI, I give you the floor now to introduce yourself.
Madame Fatou.
Thank you, Mrs. Fatou. I'm very happy to be with you all today, this third Forum Galien Afrique, and this theme for a Women Leaders Forum. My name is Ouided BOUCHAMAOUI. I was president of the Tunisian Union of Industry, and I am a Nobel Prize laureate in 2015. What we'll do today is we'll try to facilitate to the best of our abilities for the theme, listen to all of you, and to talk about the role of women when it comes to the COVID-19 response. Thank you very much. Now we'll have Mrs. Salimata Diop, that is the Minister of Women, Family, Gender and Child Protection. She is one of the rare women scientists to hold this position. She's a scientist first. She was an electronic engineer. She worked at the National Power Company. She was also the member of FAM Africa Solidarity that everyone knows now, that works on the international scene. Now she's the Minister of Women, Family, Gender and Child Protection, and she will talk to us about what they've done regarding COVID. We also have Mr. Robert GUEИ, that is the coordinator of the Food Agriculture Organization, the sub-regional office for West Africa. He's from the Côte d'Ivoire and is also an engineer. He's held a lot of position in the Côte d'Ivoire and in many African countries. And as a civil servant and expert in the food industry, I think he'll have an interesting input for us. The Professor Abdou Salam Fall, I don't have his curriculum here, but he's a sociologist, well known in Senegal. He is the director of the doctoral school of Cheikh Anta Diop. He has set up the LARTES, the research laboratory on economic and social transformations, and I believe that he will have a very interesting result of the research that have been carried out in his laboratory. We also have among us Mrs. Nathalie GAHUNGA. Unfortunately, I haven't received her bio. I apologize for that, but I believe that when she will be given the floor, then she will introduce herself. So now I give the floor to Mrs. BOUCHAMAOUI. Thank you very much. So now we'll start our panel, And I would like to ask a question to the Mrs. Minister, Mrs. Dieng. Well, your program, Family and Gender, wants to strengthen the gender component in policy, public policy, and to improve the well-being of vulnerable groups through the promotion of equity and to fight poverty. What is the role you played during the most difficult part of the COVID-19 crisis? You have the floor, Ms. Minister. Thank you. Thank you very much to you, Chairwoman, to the Professor Fatou, my sister, and to you, Ms. Bouchamaoui, for the honor that you've given me to present the result of our contribution on the fight against COVID-19 here in Senegal. Thank you for the presentation that really shows uh, the importance of such a session. It shows once again the relevancy of this session and of the choice of our facilitators. I would like to also welcome the participant and panelists. I would also like to commend my sister, the Professor Awa Michael Sek, that is president of the Scientists Committee of this third Galien Forum on the theme of the Africa facing COVID-19. So, with this gender component that is added to this theme, Women Leaders Forum on the theme of women in science, technology, engineering, mathematics facing COVID-19. So this session on gender and the response to COVID-19, which is the subject of my presentation, is to me the best opportunity to have an inclusive dialogue surrounding the crisis and on the role that is given to them in the resilience strategy following the crisis. My contribution to this exchange will, first of all, look at the impact of the crisis on men and women, and then on the response with the gender component in my department. First of all, the differentiate impact of the crisis on men and women. Researchers have agreed that we do not know much on the virus, the evolution of the pandemic, and its drawback. It's been observed that there has been an increase of the vulnerabilities in many areas. This has been showed by through studies. One study on the impact of COVID-19 by the University of Chess in collaboration with our department. A second on the effect of COVID with the gender component, and a research report on gender-based violence following COVID-19. And this was made by the Association of Senegalese lawyers. With these three studies, we've looked at the impact of the COVID-19, and we realized that it had a different impact on women and men. It has modified hierarchy in the household, and it has decreased economic power and access to health care. There has been an increase of rape cases. Il y a and the decrease of women resilience as well, an increase of women resilience. When it comes to the household, the household respondent said that they have decided to reduce some of their expenditures due to a loss of revenue. 69% uh, of these being led by women, of these households being led by women. We have a very important informal sector in Senegal, and so, of course, women were very affected in this. 80% of the women that were interviewed said that they have lost revenue, and against 70% of men. When it comes to individual companies, we still see women being more affected. When it comes to consumption coverage, we've seen that men had still more revenue than women. When it comes to less access to healthcare providers, 25% of the interviewees that needed medical care said that they had difficulties accessing healthcare facilities. It is more important for rural population and women, of course, and more for disabled people as well. There are many factors to explain this. First of all, the access to the healthcare on a geographical base, because some of the healthcare facilities are remotely, and also because of the frenzy of people that were afraid of contracting the disease. When it comes to the research report by the Association of Lawyers, we realized that there were 43.8% of women before the pandemic that suffered from gender-based violence. This number has significantly increased to 86% by the end of by now. It was also seen that there was been an increase in violence towards women. 79% due to household chores, for example. This is not usual, and this is linked to the loss of revenue by households. However, we've seen an increase in the resilience for women. With the right now, according to the index on living poverty, there has been an improvement and more for women than men. We are above average for women when men are below 50%. This is this goes hand in hand with the fact that women are more resilient to men to the crisis, and it is looking at these differences that the President of the Republic has decided, after putting into place the social and economic resilience program, has asked to his members of cabinet to take into account the specific problems of its population to better target its intervention. And it is why my department has put into place a sectoral plan with a gender component to try and lessen the shock, and in particular for women and children, but also optimize their resilient potential after the crisis. For the second part of my intervention, I would like to talk about the response that were put into place following COVID-19. In order to maintain the improvement in the implementation of SDG 5, my minister has articulated a response around four objectives. First of all, to strengthen the resilience of women. Second, to strengthen the resilience of economic unit and to help them, for example, cover revenue loss. Three, it was about ensuring the protection of vulnerable children. And six, it was to raise awareness on social distancing and hand washing and so on and so forth. We also gave some grants to women that were vulnerable, head of households that were economically vulnerable, living with HIV/AIDS, women victim of gender-based violence, women living in prisons, and so on and so forth. in order to preserve the employment. 1,000 women, entrepreneurs, women in informal sector have been financially supported with a credit without interest. Starting from the point that women are at the heart of the solution, feminist organization and women leaders were mobilized for a collect of mass collection campaign of 1,000 masks, and also a sensitization campaign on the on wearing masks and washing your hand. Another campaign on the protection of children and the withdrawal of 180 children that were living in the street and that were returned home. More than 2,000 children were helped in many regions. There were also food support assistance that were given in the same region. And even if this has given us positive results, the crisis is still happening, and its social and economic impact are still very much real. And so we need to be realistic. Moreover, public policies are invited to add hypothesis and risk of the resurgence of a crisis with the degradation of environment quality. Knowing that taking into account the gender component is, of course, paramount, and this is why two perspectives seem have a main interest for all of us to reduce the negative impact of the crisis on the population in general is, of course, with a differentiated approach, taking into account the specific needs of the different social categories. The second point would be to systematically integrate gender in our post-COVID plans in order to avoid development delays. I would like to commend this session and once again say how important the results of this third Forum Galien would be for us. Africa facing COVID-19 pandemic. Thank you very much. Thank you very much for this presentation, for what you've said on the impact of the crisis, the strategy that was developed by your country. I commend what has been done by the Senegalese government on the crisis and especially how to help women. Just as a reminder for the panel member, you could not, your intervention is only of 5 minutes so that we can respect the time that has been given to us. Now we'll give the floor to Mr. Robert Gay. Mr. President, I need to leave, so I will ask you please kindly to leave because we have a Minister Council and I need to be present. So could I please leave? Thank you. Thank you very much, Mrs. Minister, and have a nice day. Now we'll give the floor to Mr. Robert Gay, the regional representative of the FAO. My question is the following. Next to other partners of the United Nations, the FAO has participated in the COVID-19 response. The initiative, the maids basket has helped bring food to young women and to women and young people. Can you talk about this experience and of some of the innovative funding that you've initiated in this context? Mr. Gay, thank you very much. I would like to take this opportunity to thank the organizers of this forum for inviting the United Nations, and here I am representing the United Nations, but also the three organizations that work together in order to set up this initiative that we call in French le panier de la ménagère, so the maid's basket, for it is the Food Agriculture Organization, UN Women, and the UNFPA. So during the COVID-19 pandemic, the United Nations have organized themselves to be able to support governments, but also what we are here for, to help populations, and especially vulnerable populations. And here I would like, excuse me for a second, yes. Here I would like to go through the next slide, please, to explain why did we start this initiative. As you all know, with the COVID-19 pandemic, governments have taken measures to be able to decrease propagation of the disease. But the measures that were taken have had negative impact and consequences on food security, and especially in rural areas. And for example, we've seen restriction in transport to market. Some public marketplace were closed, for example. So of course, there were some difficulties linked to trading, and especially for small producers that weren't able to sell what they had grown, and especially women and agricultural products. This has contributed to an increase of the food vulnerability of a household with a really low income. So even women that would go to the market to buy, for example, fresh vegetables, cereals, grains, since market were closed, then it was very difficult for them to have access to this to food. So as I've said at the beginning, it was three organizations. These three organizations decided to support the government. As you all know, at the beginning of the crisis, on the onset of the crisis, the government put food security at the core of their response, and therefore the government has bought and distributed food and products to the population here in Dakar and in rural areas. And we have wanted to help and to complement this initiative. Women that had produced grains, rice, chicken, all of that, this was a loss of revenue for them. And as I've said, those that did not have enough to feed their families. So this maids basket were done in collaboration with the Minister of Agriculture and Rural Equipment, the Minister of Women and Family, and I would like to commend the Madame the Minister that was the first to embrace this, and also we did that in partnership with our social partners. When it came to funding, the three organizations were able to uh, mobilize more than 450 million CFA, that was between the emergency fund of the Food and Agriculture Organization, that was triggered very quickly following the evolution of the crisis. And then UN Women had the public-private partnership with the French bank BNP Paribas in order to get some funding, and the UNFPA partnered with Affaires Mondiales Canada. So those were funding, innovative funding in a way, since it wasn't really easy to mobilize the money quickly because of the crisis, of course, but also with the commitment of the organizations, funds were mobilized to be able to help. So the objectives of this initiative are here listed here. First of all, as I said at the beginning of my presentation, we wanted to decrease the loss of revenue of the vulnerable producers that had some difficulties to sell their agricultural products. We also had to bring to the household that were affected by food insecurity a diversified basket of food. You also have to note that since the schools were closed, children from 0 to 5 years old, it was difficult for were staying at home, and it was difficult for parents to be able to meet their needs, and those were the population that were targeted by this initiative. The third objective was to strengthen the prevention mechanism of gender-based violence. We all know that during this crisis period, not only in Africa but everywhere in the world, GBV has increased significantly during the confinement period. The key activities that were set up during this initiative, first of all, we had to have awareness raising to reduce the propagation of the pandemic. So we've used community radios, community mobilization, and so on and so forth. We've also distributed sanitary kits to the populations, to the producers. We also given assistance to small producers with the composition of we've asked them to help us compose the different basket, and we distributed this basket in 8 regions of Senegal. And as I said, we try to strengthen the prevention mechanism of GBV. So these were the key activities. As a result, could you please go faster? Thank you. Yes, so what we've did is that we've generated revenue for the producers. As you can see the numbers on the screen, we were able to bring food support to more than 14,000 people in different regions. When it comes to awareness raising, we've used all the means at our disposal to be able to have access to the populations, and especially vulnerable populations. And the impact of this initiative was really to improve the living conditions, but also to strengthen the entrepreneurship, rural entrepreneurship mechanism that were affected by the pandemic. I would like to finish by really thanking the organizer for allowing us to make this presentation. Thank you very much for this presentation. We'll come back to this during our discussions.
Je m'adresse maintenant au professeur Abdou
Now I'll
Salam.
give the floor to the Professor Abdou Salam Fall, that is the director of
Dans le contexte actuel, pensez-vous
social transformation laboratory in Senegal. For you, do you think that
remarquable dans la
the
contre la
ingenuity
COVID-19
of women, their involvement in COVID-19 response will allow to reduce the gender inequality, and what were the solutions that were taken by women to face confinement or transport restriction and so on and so forth?
Professeur Fall, mettez votre...
Professor Fall, you have the floor. Could you please activate your mic?
Professeur Fall, s'il vous plaît.
Professor Fall, could you please activate your microphone? Your microphone is off. Could you please activate your microphone?
Voilà, très bien. Donc, c'est à vous la parole, professeur Fall.
Je vous remercie infiniment pour...
Thank you very much for inviting me.
De cette communication, je voudrais saluer l'initiative de ce 3e forum et féliciter professeur Eva-Marie Colsec pour cette initiative, elle qui est pour nous universitaires un modèle. En fait, pour répondre aux questions que vous avez posées, je voulais m'appuyer, si vous le permettez, sur une recherche qu'on a menée au Sénégal sur 2 régions principalement et une enquête qui a permis de couvrir 3000 femmes, une enquête au téléphone qui a pu se réaliser auprès des femmes de 14 à 34 ans et 3003 femmes ont pu être enquêtées au téléphone entre juin et août 2020 avec un taux de pénétration de 77%. Et dans 2 régions principalement, la région de Kaolack dans le centre du Sénégal et la région de Kolda dans le sud du Sénégal. Pourquoi ces 2 régions? Parce que principalement, le programme que nous avons voulu suivre pour évaluer son impact en santé reproductive porte principalement sur ces 2 régions. Alors là, je présente les caractéristiques des personnes qui ont été enquêtées, des femmes qui ont été enquêtées avec une moyenne d'âge de 22 ans. 69% de ces femmes sont mariées et 15% sont actuellement scolarisées, tandis que 50% ont été scolarisées dans le passé. Je vous présente 5 principaux résultats pour rester dans les 5 minutes que vous m'avez dévolues. D'abord, en termes de violence conjugale durant la période COVID, vous voyez sur ce tableau que d'après leur déclaration, près de 39% ont déclaré que les violences conjugales ont diminué, tandis que 24,5% ont déclaré que ça a augmenté. Donc, 19% considèrent que la situation n'a pas changé et vous voyez là qu'il y a une légère diminution, une diminution relative de la violence conjugale telle que perçue par les femmes. Deuxième résultat, peu de femmes ont eu peur d'aller fréquenter les structures de santé. Là, je vous affiche les statistiques. Pour les maladies d'un des enfants, seuls 6% sont concernés par cette peur. S'agissant de la vaccination, 6%. Les planifications familiales, 2%. 1,5% pour les visites prénatales. 1% pour l'accouchement et les consultations postnatales de l'ordre de 2%. Voyez-vous, si on prend les statistiques dans le sens inverse, on a de l'ordre de jusqu'à 85% qui déclarent n'avoir pas eu peur d'aller fréquenter les structures de santé. Si on considère le troisième résultat, est-ce que les femmes ont respecté les mesures barrières? Là, les résultats sont impressionnants parce qu'on arrive à des taux particulièrement élevés de respect des mesures barrières. Mais l'impact lié à certains événements, notamment la fermeture des mosquées, la fermeture des écoles ou la distanciation, notamment liée à la quarantaine, ou les restrictions de voyage, ou la fermeture de magasins, ou la pénurie de denrées ont eu un impact considérable sur la vie des ménages. Cinquième résultat, c'est peut-être le plus impressionnant, c'est l'indicateur de faim qui est passé du simple au triple. Voyez-vous, on a là les statistiques avant COVID et les statistiques durant la période de COVID. Et on voit bien qu'avant la COVID, on était de l'ordre de 10% qui, évidemment, avaient été victimes de faim modérée ou sévère dans les ménages. Et avec la COVID, on passe de l'ordre de 38%, entre 23 à 38% selon la région considérée, ce qui montre qu'on a là une situation assez préoccupante qui est liée à la faim et notamment à la faim modérée et sévère dans les ménages. Cinquième et dernier résultat, c'est le bien-être émotionnel des femmes qui a diminué par contre considérablement. Là, on a la situation avant la période de la COVID où on a une moyenne là aussi de 9% entre Kolda et Kaolack. Et cette situation nous amène à une augmentation considérable, notamment jusqu'à 13% de femmes qui considèrent que leur bien-être a diminué considérablement. Au total, si on fait le point, on peut conclure que face à la COVID, les femmes rurales ont été fortement résilientes D'abord, la diminution relative de la violence conjugale due à la COVID-19. Par cette violence conjugale, on entend évidemment les différentes formes, qu'elles soient les violences physiques, verbales comme symboliques. Deuxième résultat, la sécurité alimentaire des ménages qui est fortement éprouvée durant la pandémie. Comme stratégie résiliente, le fait que la COVID-19 a été accélératrice d'un processus de développement d'une économie locale, notamment la hiérarchisation des besoins, comme ça a été soulevé tout à l'heure par Madame la ministre. Les femmes rurales sont réceptives aux mesures barrières. Là, je vous donne les chiffres qui ont été observés. 51% se lavent les mains 2 à 3 fois par jour et 47% 5 fois par jour. Et là, on met ça en rapport aussi avec, disons, les usages et les coutumes qui font que les femmes étant impliquées fortement dans plusieurs activités dans la journée, de toute façon, se laver les mains assez régulièrement. Et donc là, la situation des mesures barrières conforte une pratique. Évidemment, on y ajoute le lavage au savon ou au gel, alors qu'habituellement, elles se lavent les mains à l'eau tout court. Ou alors, quand ça exige vraiment qu'elles se lavent avec du savon ou du gel, c'est lié aussi au type d'activités qui ont été menées antérieurement. Mais en tout cas, là, ça conforte une pratique assez courante. Le port des masques jusqu'à 87% lors de la dernière sortie et 71% réussissent à éviter les rassemblements de plus de 10 personnes, ce qui montre globalement qu'on était là dans une situation assez favorable de respect assez strict des mesures barrières. Avant-dernier point, elles ont été informées aussi assez largement sur la COVID et les mesures barrières. D'abord par la radio et la télévision, la radio arrivant en première position, les voisins et les amis à 52%, les acteurs communautaires, il faut la saluer aussi, jusqu'à 27% déclarent que c'est par les acteurs communautaires, notamment les Badjanougo, comme on les appelle ici, les tantes des quartiers, j'allais dire, qui effectivement aident à vulgariser fortement les messages liés à la santé. Enfin, elles ont préconisé avec succès des échanges à distance et cela conforte l'idée qu'elles ont été résilientes face à la COVID. Et je voulais vous remercier pour votre attention et reste à votre disposition pour des échanges. Je vous remercie.
Merci beaucoup. Je peux passer à l'autre intervenante ou je vous laisse commenter d'abord.
Moi, je pense que oui, ouais. Je salue franchement. Moi, j'ai beaucoup aimé cette résilience des femmes sénégalaises parce que vu qu'il y a eu une diminution donc de la violence conjugale, mais de son application, de son écoute, et c'est important. Je ferai peut-être après la conclusion de tous ces travaux et je vous laisse poser la question à Madame Nathalie GAHUNGA.
Voilà, merci. J'espère que nous aurons l'occasion de revenir sur quelques questions avec
Bien sûr.
les présentations, surtout sur le cas sénégalais.
D'accord.
Bon, voilà, pourquoi en monde rural, on pense à certains résilients. En tout cas, on reviendra là-dessus. Pour Madame Nathalie GAHUNGA, chargée du genre en chef à la Banque africaine de développement, la BAD, en Côte d'Ivoire, la question est quels sont les effets de la pandémie sur les femmes et comment pourrait-elle se saisir de cette nouvelle donne pour s'émanciper et acquérir plus d'autonomie? L'Afrique peut compter sur ces femmes pour se relever de la crise du COVID-19 ou de la COVID-19. Est-ce là un slogan ou une réalité? Sur le continent, beaucoup d'initiatives ont été mises en œuvre par les femmes pour s'adapter au confinement, vente à distance, usage de Cheikh, c'est les motos pour l'approvisionnement et la livraison. Pouvez-vous partager avec nous quelques-unes d'entre elles. Merci.
Je vous remercie. Alors, je vous remercie donc d'avoir invité la Banque africaine de développement. Et alors que la pandémie met à rude épreuve les modèles économiques mondiaux actuels, les personnes employées dans l'économie informelle sont touchées de manière disproportionnée et les femmes sont les principales victimes des retombées économiques et sociales de la pandémie. Par ailleurs, une étude récente conduite par ONU Femmes, là-bas des impactaires, a montré que la pandémie entraîne également des impacts négatifs sur les petites et moyennes entreprises, en particulier pour celles qui sont dirigées par des femmes. Or, les PME créent environ 80% des opportunités d'emploi en Afrique. Dans le domaine de l'accès à la technologie, les femmes d'Afrique subsaharienne sont environ 45% moins susceptibles d'être en ligne que les hommes. Cela se traduit par moins de femmes africaines propriétaires de PME participant au commerce électronique. Cependant, les entreprises à technologie avancée sont essentielles à la survie en temps de pandémie. Cet écart, s'il n'est pas comblé, perpétuerait et empêcherait les entreprises dirigées par des femmes de participer à une économie de plus en plus numérique. Pour amortir les impacts de la COVID-19, les gouvernements africains ont déployé des plans de relance, des politiques fiscales et monétaires qui ciblent les entreprises. Cependant, très peu de ces mesures et politiques prennent en compte des barrières spécifiques qui empêchent les femmes entrepreneurs de se développer et d'avoir accès aux mêmes opportunités commerciales que les hommes. Si des mesures appropriées ne sont pas prises, la pandémie pourrait potentiellement creuser l'écart de financement entre les hommes et les femmes, qui était estimé avant la pandémie à environ 42 milliards de dollars. Par conséquent, il est impératif de prôner une mise en œuvre délibérée de politiques et des solutions soucieuses de l'égalité des sexes. Au niveau de la Banque africaine de développement, celle-ci a développé une quarantaine de projets d'urgence de lutte contre la pandémie à travers l'Afrique, axés essentiellement sur la santé publique, les transferts monétaires, l'assistance alimentaire, en particulier pour les femmes. En Tunisie, par exemple, vous avez un projet où 70% des bénéficiaires sont des femmes et il y a aussi une assistance pour les petites et moyennes entreprises. Je voudrais préciser ici que la Banque place l'égalité des sexes et l'autonomisation des femmes au cœur de ces opérations. Une nouvelle stratégie genre pour la période 2021-2025 est en cours de développement et tient compte de l'impact de la pandémie. Le deuxième pilier de cette future stratégie est étroitement lié aux sciences, technologies, ingénierie et mathématiques. Il s'agit d'accélérer l'employabilité et la création d'emplois pour les femmes. Ce pilier se concentre sur l'amélioration de l'accès aux compétences et aux emplois, comme je l'ai dit, en tenant compte de la nécessité d'introduire davantage de femmes dans les domaines d'estime. Il s'agit également de tirer parti de la technologie pour améliorer l'accès aux compétences et à l'information. Il est un fait que les femmes sont des piliers des économies africaines. En effet, il a été démontré que les femmes investissent 2 fois plus que les hommes dans le bien-être des familles, améliorant ainsi la vie des autres membres de leur ménage et de leur communauté. Mais pour ce faire, la condition sine qua non est qu'il faut les autonomiser et leur donner un soutien adéquat et reconnaître le rôle phare qu'elles jouent dans les sociétés africaines. Alors, en période de pandémie, la Banque a bien évidemment, donc, outre les projets d'urgence dont j'ai brièvement mentionné l'existence, la Banque a également adapté son approche d'intégration du genre dans le domaine d'estime. Ainsi, la Banque et ONU Femmes ont développé un projet de chaîne de valeur en Côte d'Ivoire à travers une plateforme mobile appelée Buy for Women, où il s'agit de fournir des informations aux agricultrices sur les marchés et les finances. Et aussi, donc, il y a aussi un volet renforcement des capacités et beaucoup d'autres activités. Alors, il a été décidé donc d'adapter, suite à la crise, il y a une étude qui a été faite pour identifier les problèmes spécifiques auxquels font face les femmes en zone rurale et trouver des mesures d'atténuation, notamment des formations en ligne. Il est prévu notamment des formations en ligne et aussi des séances de prévention contre les violences basées sur le genre. Un autre projet important, un autre projet phare pour les agricultrices africaines, c'est l'accès aux technologies adéquates pour améliorer leur productivité, grâce au programme Technologie pour la transformation agricole en Afrique, TAT. Un autre projet très, très important, c'est le Bank Coding for Employment Program, en partenariat avec Microsoft. Et donc, suite à la pandémie, il s'agissait donc de formation pour les jeunes hommes et les jeunes femmes pour un accès aux outils numériques et les doter de TIC, et aussi leur donner donc des formations d'entrepreneuriat et aussi des compétences générales pour être nécessaires pour être compétitifs dans une économie numérique. Donc, suite à la pandémie, toutes les formations sont en ligne, y compris des formations spécifiques qui sont réservées aux femmes, qui comprend un volet sur les compétences de vie ou des rôles modèles dans l'espace des compétences technologiques et numériques, partagent leur histoire avec les cohortes et jouent le rôle de mentor pour les étudiants tout au long du programme. Enfin, je parlerai du nouveau programme d'action affirmative pour les femmes en Afrique, AFAWA, qui a pour objet de combler le déficit de financement auquel sont confrontées les femmes africaines à travers des programmes qui créent des opportunités pour les femmes d'obtenir des financements pour le développement de leurs entreprises, y compris dans l'estime. Je vous remercie.
Merci beaucoup et je tiens à remercier aussi l'impact et le rôle de la BAD concernant l'activité économique en Afrique et surtout ce programme que j'ai beaucoup adoré pour encourager la femme et pour impliquer la femme dans l'entrepreneuriat, parce que moi, je répète tout le temps, je dis que, comme disait Simone de Beauvoir, la liberté de la femme commence par son porte-monnaie. Lorsque la femme a cette indépendance financière, ça permet d'avoir plus de dignité, ça lui permet aussi de faire face aux soucis et d'éviter certains problèmes. Donc, il est temps aujourd'hui qu'on s'occupe de la femme entrepreneur, de la femme qui est motivée pour être indépendante et de lui donner tout le soutien nécessaire, de la former, de l'encadrer, puis mettre à sa disposition ses moyens financiers. Donc, bravo pour ce que vous êtes en train de faire à la BAD et je souhaiterais qu'il y ait plus d'informations de tous ces programmes-là pour que ces programmes-là soient un peu mieux connus dans les régions de l'Afrique et surtout vulgariser ces programmes-là et faire connaître les success stories et comme ça, on aura toujours devant nous de rôles modèles et ça permettra aussi aux femmes dans d'autres pays de l'Afrique de retenir les leçons et de faire donc comme celles qui ont réussi. Je remercie tous les panélistes parce que c'est vraiment très enrichissant. J'ai beaucoup appris des expériences des uns et des autres. Et là, si ma collègue aussi le permet, on va passer aux questions et de ceux qui sont présents. Donc, si jamais il y a une question parmi les présents, je vous demande de bien vouloir lever la main, comme ça on saura qui va poser les questions. Et donc, on se chargera, moi et professeur Sao, de donner la parole aux uns et aux autres. Parmi ceux qui sont en train de coordonner ce programme, si jamais il y a des questions qui sont écrites, vous pouvez nous faire passer ces questions. Sinon, on continuera nous-mêmes.
Voilà, je me disais qu'en attendant que les personnes se signalent, j'aimerais juste revenir sur deux comparaisons. Le travail fait par la BAD et par la FAO, qui se complètent quelque part en permettant de fonctionner sur la résilience, de répondre aux questions concrètes immédiates, mais en même temps en se projetant sur le futur pour avoir d'autres façons de faire ce que la BAD est en train de faire. C'est extrêmement intéressant. Les deux cas du Sénégal, Madame la ministre a parlé de la difficulté, la plus grande difficulté des femmes à faire face, ce qui correspond en tout cas à des études que nous-mêmes nous avons menées pendant cette COVID. Le travail de M. Fall est extrêmement intéressant aussi, mais je lui poserai la question, est-ce que c'est parce que la zone qui a été identifiée est la zone la moins touchée par la COVID? En fait, les comportements certainement à Dakar, ou Dakar, Thiès ou Touba, qui étaient les axes les plus affectés, les zones où la COVID a été la moins affectée, peut-être ça explique ce type de comportement. En tout cas, les résultats sont tout à fait très intéressants et très positifs, mais peut-être qu'il faudrait regarder en quoi ces zones-là, par leur relation avec la COVID. Et deuxième élément aussi, ouais. Donc voilà, peut-être que c'est sur ça qu'on va revenir entre ce qui se passe à Dakar et ce qui se passe dans les zones rurales qui sont les moins affectées.
Si vous permettez, allez-y.
Oui,
avant de passer la
allez-y.
parole, parce qu'il y a une personne qui souhaite parler en audio, donc on va écouter sa question, puis après on donnera au professeur Fall le temps pour répondre à votre question. Donc c'est Monsieur Ahmed Idousourou qui est avec nous en audio, donc c'est à lui la parole.
Thank you very much. Good morning.
Good morning.
Thank you for the presentation. Unfortunately, I cannot hear most of it because I can't hear the English interpretation that has that problem. The IT can look into it. I cannot hear the English interpretation. So I missed most of the session because of that.
C'est l'interprétation qui n'est pas faite en
yeah. Do you have any question, please?
No. Elle dit qu'elle n'a pas eu la chance. Elle ne pouvait pas. Il n'y a pas eu d'interprétation. Beaucoup de choses leur ont échappé.
Sans souci. Donc, c'est à vous la parole, professeur Fall.
Je vous remercie infiniment de questions et des commentaires que vous avez voulu faire. Et au passage, je remercie aussi ma grande sœur Fatou Sousa pour l'introduction qu'elle avait faite au début. Alors, les résultats que je venais de présenter, qui résultent d'une étude que le LARTES, le laboratoire que je coordonne à l'université, et l'IFPRI ont réalisé, ces résultats sont contre-intuitifs parce qu'on s'attendait à ce que les femmes réagissent plus fortement là où la COVID a le plus de taux de pénétration. Lorsque les personnes vivent avec d'autres qui sont affectés directement par la COVID, on peut penser que les réactions de protection deviennent plus fortes. Or là, nous avons enquêté en zone rurale relativement éloignée et donc 2 régions qui font partie des moins touchées d'une certaine manière par la COVID. Et on voit que les comportements, les précautions qui sont développées par les femmes renvoient à une situation spécifique, qui est peut-être le résultat aussi de l'intervention en santé reproductive qui caractérise ces 2 régions. Parce que nous avons enquêté là où les programmes ont été mis en œuvre, le programme santé reproductive. Et donc, c'est peut-être ça le résultat, le fait que l'accompagnement qui est fait par les acteurs de développement a eu l'impact considéré là au sein de ces femmes rurales qui, d'ailleurs, souvent développent des habiletés assez fortes, autrement qu'on ne les envisage au départ. Donc, c'est ça que je voulais dire pour répondre aux questions que vous avez bien voulu soulever. Je vous remercie infiniment et je reste à disposition pour d'autres commentaires.
Merci à vous. Moi, j'ai une question à tous les panélistes. J'ai remarqué lors de ces enquêtes qui ont été faites au Sénégal, c'est que...
I have a question for all the panel members. I've seen that there was with the COVID-19 and in Tunisia ourselves, we have seen that the number of conjugal violence were increased because people living in small spaces exacerbated tension, so there were more problems, and men in a way are not used to staying confined, staying every day at home in small spaces. And I think that with this unusual contact every day, in the studies that were carried out, it demonstrated that there were more and more violence. So I don't really understand why for you it's been decreasing. That's my first question. And my second question is also, I've really liked the aid, the assistance that the Senegalese government has given to vulnerable women, especially this maids basket, all these initiatives to encourage local consumption, but also to pay them, to give them something so that they could face their revenue losses. However, is this maids basket that was carried out with three organizations, UN organization, I may add, is it still done, or was it still over? Was it only over a short period of time? Can you hear me? Yes, we can hear you. So yes, if one of the panel members would like to answer my questions, please. I think that the professor maybe will answer the first question, and I would like to answer the second question. To just say that this maids basket, with the funding that I have announced during my presentation, it is a funding to start. All these organizations, given the success that this initiative was, all these organizations are currently working towards continuing the effort. This process started so that every month, at the beginning of each month, we could buy and sell. During my presentation, maybe I didn't say that. In the valley of the Senegal River, there was thousands of women that produced rice and that weren't able to sell it. I myself went on the ground with other NGOs, and what I saw and what I witnessed with my own eyes was absolutely extraordinary. For grains, corn, maize, rice, what wasn't sold, and that the program was able to buy and put at the disposal of this basket. So it's an ongoing program. We also have donors that are more and more interested by this initiative. So it is a program that will continue for a certain period of time. If I may add something, yes, go ahead. Professor Fall would like to answer the first question as well. Yes, and then we'll give you the floor, Nathalie. Thank you very much. So I would just like to say that when it comes to the observatory to monitor COVID-19 that has been set up by the Ministry of Higher Education, I'm lucky enough to coordinate the group on impact study regarding the impact of COVID on family, society, and so on. Many studies are being carried out as we speak, and maybe these will allow us to have the answers covering the whole territory. There is a study on the impact on the family, on religion, on the diaspora, on cultural actors, etc., that are all ongoing. It's by phone survey. As an hypothesis, many of us thought that given social distanciation that exists, that the confinement situation will bring actors within households to learn to live together in small spaces, sometimes in promiscuity, that this situation would lead to more violence. That was the general observation at first. That was the intuition that we had. However, the results showed the very opposite at the moment. Maybe we can formulate this hypothesis, the underlying hypothesis that COVID-19 has increased emotional intensity, that had brought actors, women and men, to learn to live together and to face certain form of violence by instituting a communication mechanism, because social distanciation are quite between men and women within households. Generational distance, for example, that were reduced, significantly reduced due to the COVID-19 and to the semi-confinement that we lived through. At the moment, we are just making hypotheses, and future studies and ongoing studies will allow us to have, in a way, more exhaustive answers for the situation. But the research that were carried out indicate the opposite for rural women. Conjugal violence have significantly decreased if we look at the statistics that I've shown you earlier. Thank you very much. I'll give the floor now to Miss Nathalie Gouinga. Now, and then I want to come back to these studies, because there are many studies that state the opposite, and that as well, the one that the minister has just explained to us, that shows an increase in gender-based violence, going from 43 to 65% to 85%, because call centers have collected more data on violences, and we've seen in the colder region that more and more women have said that they've been victim of GBV. I say once again that sometimes people give socially acceptable answers when you call them on the phone. Between the call centers answer that collect every day violence complaints, have shown that there has been a significant increase of GBV in Dakar. Now, it is true that there have been hypotheses that the rural world has different behaviors. So it's not just Senegal, it's really localized. Maybe when we carry out all the studies, then we can have a better portrait. Mrs. Nathalie Gouinga, now you have the floor. Thank you. Thank you very much. Very quickly. On GBV, we've seen that in most countries covered by our institution, that has been a significant increase. And for our project, what we do is that we always put into place measures against GBV in most of the projects that I've mentioned. And there has been a very important initiative in South Africa. Given the increase in GBV, the government has accepted that policies were put into place to fight GBV, and this is one of the projects of the African Development Bank. When it comes to Senegal and the different projects that were put into place, especially the one by Mr. Ndèye, there are a lot of good practices, and we are interested. So we would like to say that we have documents that we call gender profile, and we are trying really to connect good practices, to collect good practices, not only take a stock of the situation, the gender situation in countries, but really show good practices so that we can translate it into transpose it into other countries in Africa and show the diversity. Thank you very much. Thank you very much. I wonder, though, if in certain countries, maybe we'll talk about Senegal more, but I wonder if the minister talk about discrimination, gender discrimination, the fact that women do not have access to certain services, but what can we put into place so that women are more involved in decision making, and that they are also on the ground, so that there can be a certain equity in access to training, to healthcare, and the fact that women won't be afraid of the pandemic. How can we do so that women are more motivated to be more involved in the civil society, in other organization and NGOs because they have a role to play as mothers, as a lead of household. They have a role to play, to convince, to influence, but also to initiate, and especially for children when it comes to social distancing, to washing your hands, all the preventative measures, and also involve so that on the financial side, they have all the means necessary to survive. Before someone answers, I would like to say that there are participants, there are questions and comments. Abdullah and Ka said that when it comes to the FAO presentation, I would like to know the lesson learned on the GBV cells when it comes to their results and limits. Now, Elhaj Ndèye said that the research result of Mr. Abdou Salam Fall shows the necessity to have an African approach to fighting COVID-19, even if the research has been carried out in rural areas. It shows a decrease of GBV compared to what is happening in the West. But I would like to say that this is a limited research. There are many studies measuring that there have been more and more an increase of GBV. When we're able to measure, the studies have shown that there was an increase. This is a study where they call people and people just say. So I just want to say that this study by Mr. Abdou Salam should not bring us to generalize what is happening. We need to wait for all the results to come. And I can come back to how there has been an increase with the amnesty research or the Committee of Women Studies. I think that this study of Mr. Abdou Salam shows some limitation. Maybe Mr. Abdoulaye Ka can have the answer of the FAO on GBV, the results and the limitations. The cell. I would like to thank the participant that asked the question, of course. As I had said at the beginning, this initiative is shared by 3 organizations, but the implementation was carried out by each organization depending on its mandate. So we decided to work together so that we could, work with all the results together. The preliminary result is what I presented. This part was implemented, of course, by the UNFPA, that is in charge with everything around gender-based violence. So I do not want really to give you numbers or say things that are far from reality. If I have maybe the email of the one that asked the question, then I can put him in contact with the director of the UNFPA so that they can have more information, more concrete information on the question. I would like to say a few words, if that's possible. To the question that you asked, I want to say that yes, we need to insist on community approach when it comes to COVID-19 response, of course. I believe that the strategies that were developed needs to be strengthened in this direction, of course. This is what I wanted to say. Of course, when it comes to my colleague and big sister Fatou, of course, we are all called to develop call inquiries, call surveys, and especially with COVID-19, we do not have any choice in the matter. It's a learning process for all of us, but what I can say is that we were rigorous. Really, we've worked very hard to really train the people asking the question over the phone. And the research results are also that. we have hypotheses, and we realize what is really happening during the survey. For the 3,000 responded, 39% say that GBV have decreased. However, at the same time, 25% said it increased. And 19% said that the situation hasn't really changed for them. 17% said that they do not know. They just do not know, they could not answer the question. So let us say that these are results on two regions in Senegal, on an active population of women, and other results, of course, will come to question maybe this, and this will allow us to see that where there was an intervention, meaning a community approach in reproductive health in rural area in Senegal, we have had these results during COVID-19. We were also able to make observation not on violence, but on hunger during and after COVID, and I've shown you that the situation had, of course, seen a degradation for these households in rural areas. Thank you. This is what I had to say. Thank you very much. It's less for you, of course, than for our friend Souleymane Somare, that has given hypotheses so that with your result we can generalize everywhere, because since it is the situation in Senegal, then he has other analysis. No, it was just to tell him that we need to be careful. There are other studies that show the opposite, and with time we'll have the exact situation of the countries. But since there are other people that are against the West and against the gender approach, you know, we are scientists, so we need to be careful and to wait for all the results to know what it represents for the proportion of the study, and then we can move forward. This is why I had the reaction. Thank you.
Bonjour.
Bonjour. Good morning. Professor? The Minister of Women would like to take the floor. Thank you very much for allowing us to take the floor yet again. We would like, first of all, to commend the Professor Fatou Sosa and the Professor Awa Maricol Sek and every member of this platform. Very informative. As the Professor Fatou Sosa has said it, and thankfully she has, the study was targeting rural women in Kolda and Kaolack. And the minister has said that factual data that she has given you were issued from 7 regions. The other analysis you have to take into account is that what we had the comparison between rural area and urban area, and I think it's very important because confinement usually that is a factor of an increase in violence. It's not the same in rural areas since they have more space, of course. Something else that we need to take into account and that can explain the decrease of GBV in the 2 regions that he has mentioned is the fact that with the curfew, it can settle and decrease GBV, because sometimes issues within the household is linked to transportation, and also the measures and were in Kolda and Seydou, because those are the intervention areas of the UNFPA, and the UNFPA has this policy to eradicate violence. With the UNFPA, the minister has had immediate action with all actors and especially young women when it comes to raising awareness, but also offering services. And this is why, as the Professor Fatou Sosa said, we need to combine all the initiatives and really look at the results and look at the result, and we can see the trend there. When it comes to the question of Madame BOUCHAMAOUI, the implication of women, on the involvement of women in Senegal, we can say that women were at the forefront of the fight against COVID-19, and this is what what triggered us to use the slogan, "Women are part of the solution," because there are actors, there are solution finders, and it has been shown during our answer to the COVID-19, women, leaders, women, whether they work in the political sector or in the religious sector, they have all contributed efficiently to sensitization, to respect preventative measures, but also to service offering when it comes to distributing food kits or sanitary kits. But mothers as well have found innovative solutions. This is the case of Senegal. I do not want to talk too long, but I think that other studies will help us to look at that, and we want to maintain this dynamic to add value to women. Thank you very much. I would like to commend the commitment of the Senegalese government. When you have this political will to push women forward, you can see results, and therefore it is very important, as you have said it, that women are part of the solution. Of course, if you involve women, then you find better solution, and they'll be better sensitized and better aware of what is happening. And so, just as you said it, I commend what you've been doing, and I hope that women will be more and more involved in political life as well. They represent most part of the population after all. Thank you very much. And just to say myself, maybe I have more of an interrogation since I am the head of a company. I will have this interrogation on losing revenue, and this makes women always vulnerable. And so, because of an issue with transportation, they could not move around. There is a loss of revenue, of course. And despite the fact that the government is doing its level best to compensate, there is still a loss. So, is there any way to strengthen community work so that there is more sensitization? You said bye bye women as well. You talked about it, but women working together to create a chain to better sell their product and incentivize people to consume locally. No, go ahead. Yes, I just want to say that when it comes to us, for agriculture and production, when it comes to cattle farming, when it comes to fish farming, women play an essential role in mobilizing products in their distribution in markets and so on and so forth. But what's really impressive in Senegal is the fact that there are organizations, women organizations, women platforms that work together and that allow, and when I said that I was working on the ground, actually, it was with a very dynamic women association. And when we went to certain areas, we realized that women were really working together and being really dynamic. They were open shops and to be able to store their products and then sell them. And I just want to say that on the long term, we work with these platforms already. And when it comes to digitalization with the maids basket, we try to innovate so that this loss of revenue would be compensated, but also to assist them, to support them with agriculture input, with mechanization, to allow them in a way to increase production and therefore to decrease the losses, especially during COVID-19. COVID-19 isn't over, but we have started already our post-COVID programs with these women that have started producing again. Thank you very much. I would just like to say to Elhaj Main that came back to us. So I think it's he says that he's not against the gender approach. He's is ready to talk to us about it. He just says that we need to rethink the COVID answer in Africa. We agree and we understand each other better. So in many countries in Africa, and in the Sahara have an associative tradition. So the FAO has worked with the Association of West Africa Women, have that regroup different women from different region. But they said that they didn't have enough investment in storing and selling their products. It wasn't with the production part. Thank you very much for your intervention. I would like to really commend once again the initiative of the FAO. It is also a partner of the of the African Development Bank. We have project in the agriculture sector. We have assistance when it comes to manufacturing, transforming products, and value chain where women are the main actors. I think it would be interesting. I cannot give you the whole list, but I think that it would be very interesting to work together. The role of women in agriculture is key, and especially in transformation. There is a question we work on. It is the access to energy. Because if you want to process agricultural product, then you need energy. And we work with countries to help to have intervention in that direction. And just as an informative note, we have different category for our project. We need to add the gender component to all our project. You talked about access to decision making. So this is something we always take into account. And when it comes to access to economic resources, it's also the case. Usually you have a project and a small percentage is given to women, for example, for vegetable market. But we want women to be an actor in her own, so that she has access to the market like men, and this is by working with civil society and by working with the government. And to us, Senegal is in a way, is also a model. We just have a few minutes. We'll give the last few words to each panelist, and then I'll give you a little bit of a summary, because we need to respect. Yes, thank you. I just want to insist on the importance of the domestic market as being the main being the main target of the work on food processing, because when most projects look at exporting, but to the need to feed the domestic market should be the priority, because we've seen that the potential of resources that we have is really significant. And today, these resources are exported more than used locally. And yet, the level of malnutrition is higher than ever. It is increasing rapidly, and it would be useful to reverse the trend. Yes, Europol have a very important role, but they are more towards exportation. And new projects need to look more at the local consumers. And I think that this is the priority of, this should be the priority. This is what I wanted to say. Thank you very much. Mr. Robert Gay, please, a last few words. I would like to very quickly say that in Africa, for the FAO, we believe that we cannot mention these question of food insecurity without talking about women. It is impossible in Africa. We all know the role of women in this. However, they still do not have access to production mean. And with the FAO, we make of it our we use it to be able to deal with food insecurity and zero hunger. This is how we work. And thank you for inviting us. Thank you very much. Mrs. Gahinga. Yes, I would like to thank the organization and just say that for the ADB, we think that women are actors of their own. And for us, one of the priority of our new strategy is access to funding and market, because women should not just be able to sell our product at the regional international level, but especially at the local level. Thank you very much. Please, before your last word, I have a last word myself. My last word is to the Professor Eva Maricosek. I would like to thank all the panelists and thank our minister for allowing us to participate in this panel, and also thank her for the work she's doing. I would like to commend the Minister of Women and Children for her commitment to help and also put women at the very center of everything that is happening in Senegal. I would like to thank our panelists because it was very interesting and what Senegal does to help women. However, we still have the question of the involvement of women, which is very important for us. But I see that people are more and more aware that women have to be involved in all decisions. We need more studies, more specific studies to understand the involvement of women, the loss of revenue of women. We need to carry out more studies, more communication, to associate women to decision making, and to think that after COVID, there will be economic and social consequences. So we need to prepare the adequate strategy to put women from the informal to formal sector, so that women is also has social protection, works in an organized structure, and so that she can ensure the future of her family and her future as well. With everything that has been said today, the financial side, help to women and especially vulnerable women that have financial issues, those are just premises to help the real work. The real work will start after having a impact study. And I think that we need to do a lot of things so that women can have access to credit and funding, and especially involve women in everything that is around digitalization and the technology. Women needs to be updated and use technology so that they can be involved and be able to better use the product and sell the products and have more means. Support to women is still a priority for international organization. Women need to be supported. So we need to find other way to fund and help women, and especially rural women, even though there have been, as we've seen in many studies, that there have been a better awareness of the consequences of this pandemic when it comes to the preventative measures. Women were more involved. They answer more favorably to these recommendations. However, it's always a national case. Men and women need to be involved because up to now, we do not know the real consequences. And to end on this note, women, as the Minister of Health has said it, women are should always be at the forefront. They are part of the solution. It is with women that will be able to for your involvement. Thank you for your involvement. Thank you for this. I would like to thank you and thank Mrs. Salimata Diop for the chance of being with her and presiding this and chairing this panel. Thank you, thank you, thank you. I hope that the next year we'll be able to all be here in Dakar for the next forum on women leaders, women, and especially women in science, technology, engineering, and mathematics facing other problems. Thank you all and see you soon.